I'd like to speak about infertility in women. It seems like this is such a huge problem compared to what it was. I guess it's always been a problem for some women, but having a healthy lifestyle, being active, eating a clean diet, a more live whole foods, 6 to 9 servings of vegetables per day. Seems like a lot, but a half a cup's a serving. If you eat a decent salad, that's at least 6 servings there. And then the other thing is a couple dark berry fruits. Ovulation has comes with many consequences to make. When do you ovulate? Typically days 10 to 14 of the female menstrual cycle, with that being 28 days. So I think the first thing is you have to look at the oocyte, which is the egg, and what actually helps that egg to mature and to be available for the sperm to inject for reproduction. I'd say first thing is if you have poor oocyte quality, and that can be from a bad diet, exposure to a lot of pesticides. If the female has a diagnosis of polycystic ovarian syndrome or PCOS, then that usually is high testosterone, either low or medium amount of estrogen, and usually low progesterone. You need progesterone for the egg to implant into the uterine wall, and that's very, very necessary. When you're pregnant, you can make up to 400 milligrams of progesterone a day to maintain the pregnancy. When you're just cycling without being pregnant, the average is 30 to 40 milligrams a day. So you can see there's at least a 10-fold difference in progesterone. It's a calming hormone. It helps the egg implant into the uterine wall. So it's really important to make sure you can get your levels checked. We do that through the Dutch test, and Dutch stands for dried urine testing for comprehensive hormones. And so we can check your progesterone, all 3 estrogens, your testosterone, which doesn't have as much play in reproduction. So, you have to make sure that your thyroid's okay. So your thyroid has a huge role in the female, her ability to get pregnant. You need to check T4, free T3, and check an iodine level. Iodine during pregnancy, the iodine level in the blood should be about 220 or so micrograms that you consume. You can get that from, plants, which is seaweed, has a high count of iodine, or you can do it supplementally. So all those things are really important for your health to get pregnant. So what are some foods that actually have a lot of iodine? And believe it or not, it can be dairy, it can be eggs, it can be grains, seafood, all kinds of foods like that. Fruits, grains, and vegetables, they all have iodine in them. So when you're looking at the fertility aspect, some women have miscarriages early on, so their body is not able to maintain that implanted egg, whether that's done naturally or whether that's done what's called a gift procedure, when they implant the egg and the sperm together and then implant that into the uterine wall. One of the things that they check typically is an estriol level. Estriol is a weak, gentle, protective estrogen, and that compromises about anywhere from 60 to 80% of the total estrogens that are made. The other 2 estrogens are more potent and concentrated, and they are estrone and estradiol. But really, they really look at that protective estrogen for implantation into the wall. So if you have, some women have miscarriages because their cervix actually shortens, or it's considered it ripens. So whenever you're getting ready to have a baby, that cervix is like, say, a certain length, and then that length actually decreases, and then the circumference of the cervix actually gets thinner. So that's called cervical ripening, and that's whenever that's ready for the baby to come out. So cervical ripening, if you have miscarriages early on, we do some things with intravaginal progesterone. We can do those in high dose suppositories to help maintain that pregnancy. So if you have any other questions about infertility, in case that's you, first of all, I'd like to talk to you about that and see what we can do to help the chances of you getting pregnant. Just give us a call and we'll help you on your journey to good health and hopefully another little one coming into the world. Thanks for watching. If this information was helpful, hit that thumbs up button down below. If you want more videos like this, hit the subscribe button down below, then ring the bell next to it. Also, if you know other people that you would want to share this link with, please do so, because I would love to help them on their journey to good health.